What is the point of a vaginal exam, and why does your doctor or midwife do it while you're in labor or even before you're in labor? So this is my little friend. This is a cervical dilation chart, and this just helps to explain how big the cervix needs to open in order to be able to push. So you're gonna start off tiny, very small cervix here. And then it's going to get bigger and bigger and bigger. So while they do the exams when you're in labor and they say you're 5 centimeters, this is how open your cervix is. And they do it all by feel. So when we insert our fingers into your vagina and then we try to find your cervix, this is what we're feeling. What we're feeling here is the baby's head. So a baby's head is usually sitting right on the cervix, and then we can feel around and know that you're about 5 centimeters. We do it all by feel. So now every provider gets to know how open their fingers are, and it's just a feel thing, muscle memory. But then this is about 6 centimeters, this is 8, and then this is 10. So you won't feel any cervix left, and that's when you're ready to push. Another thing to note is that the cervix doesn't only open, it also thins out. So you can see here, it's kind of thicker, and then it starts to thin out really thin here. So you can be, we use a scale from 1% to 100%. So when you're 100% effaced, it's called, so that's the amount of thinning, that's what we want. We want it to be 100% effaced. It'll start out really thick and closed, and then it will thin out and open. So those are all the numbers you might hear. So you might hear your doctor examine you, say you're 5 centimeters and 60% effaced. And then by the next check, hopefully you will be a little bit more effaced or open or both. So those are all kind of little terms that you might hear while you're in the labor and delivery room.